There's been a lot of focus, and for obvious reasons, on the New York tri-state area. But I heard the governor a couple days ago sound the alarm. How concerned are local officials in New Orleans about what is happening there with the virus?
Very concerned, Chuck. You know, you talked about that alarming growth rate. Let me give you some numbers to make this thing real. So just in 24 hours, we have seen an increase in cases here in Louisiana. 407 more cases today than this time yesterday, and an increase
on this $2 trillion package. Now, some of his underlings.
I was just about to ask you that.
Right?
Yeah.
And silence can be telling. Now, Mnuchin's out front saying that the president 100% is behind this. Officials have been telling me that privately. Stephanie Grisham was on Fox in the 10 a.m. hour talking about that. And yet, we haven't had the public embrace from the president. And that, to me, is telling. So we'll see if he does come out and what he has to say and what the numbers are now in just a little bit. Chuck?
Boy, between some Republican senators, Andrew Cuomo not happy, some on the left not happy, this thing's getting a bunch of cuts there. Anyway, Hans Nichols, Rahima Ellens, Blaine Alexander, three great NBC reporters on duty, out in the streets. Thank you all three for being out in the streets for us to bring this story a little bit closer to folks. Joining me now to try to get a better handle on how things are going in the southern part of this country, I've got the Atlanta Mayor, Keisha Lance Bottoms, with me. Madam Mayor, let me ask you, you've talked already about being overwhelmed, that your ICU beds are being overwhelmed. Tell me about your situation right now in Atlanta.
We are watching New York very closely. And what we know is that our largest hospital in the city right now is 90% at capacity with its ICU beds. What our public health professionals are telling us is that by May 3rd, we will be beyond capacity. And so it's the reason I took the extraordinary step in our state to close our city down, because we know that we have to stop the spread, and the only way we can do that is to get people to stay at home. And I can say, thankfully, people are watching Msnbc, they're watching national news, and they see where this will go. And we've not had any issues with people complying with this. And it really is our hope that the worst does not happen here.
Chuck, we've been reporting this out all afternoon, and it seems like at this point it's just noise. It may be something that affects timing. It may be something where you see an amendment vote on the floor or some other hiccup. But I will say that the folks in charge are trying really hard to push this through no matter what. I think none of us have ever been here before, right? And I've never seen the kind of urgency that we're feeling from everyone across the board, and just to be able to get this written and pulled together. Sorry, Chuck, call you.
No worries, got to cut you off. It's the POTUS time, and here he is.
So, nice to be with you. America continues to gain ground.
We all have a role in preventing them. So thank you for the work that you do to get our message out to others, to really ensure that every American understands how important their role is as we move through these next 5 days, to not let up for an instant. I hear some reports that someone said, oh, well, the new cases in New York are increasing, or the hospitalizations are increasing. The number of new cases over the last 3 days have been consistent, but not rising any more than a consistent day-over-day rise. You will see hospital cases continue to increase because they are a reflection of what happened 1 to 2 weeks ago, before the full mitigation efforts were put into place. So each person in every place, no matter what county, what community, what state, can work with us to ensure that we prevent the spread of this virus to others. So thank you.
Thank you, Mr. Vice President. I just want to spend a couple of minutes telling you a little bit about some information that I got on our weekly call that we have at least once a week with the WHO, which is led.
Can take another, but it is clear that we need to do more for this country through access to health care.
Really interesting and striking to hear you say that. Before I let you go, I want to play something from a governor. We've been hearing from different governors about the challenges, striking a different note than the president. That is to say, this president, any president, obviously is within their rights to discuss potential policy that he has policy ideas for at some point shifting back to a higher workload, higher involvement in the economy. But what was striking from this governor and others is the view that there is a fine line between saying that and giving out information that may lead people to take risks and underestimate what they need to do right now. That the notion of just going back to your house of worship by Easter, for example, is not actually good scientific advice. So take a listen and then give us your view on the other side of Governor Murphy. Take a listen.
I think the order of business is pretty clear to us, that we break the back of the coronavirus first, and then we begin to open up the economy and society. That if we somehow transpose those steps and we begin to prematurely open things up, I believe we only throw gasoline on the fire of the virus, and that we pay a far bigger price down the road.
Medically, in terms of the precautions that people are taking, do you agree with what he said?
Yes, and here's why. We don't have a vaccine yet. We don't have a way to kind of prevent healthy people from getting this virus. So just from a strict medical perspective, if you have, let's say, if we're lucky, 70% of our population does not get sick, and in 2 to 3 weeks, they come out and we have no vaccine, no treatment, and they become susceptible to this virus, and we have another kind of second wave, we are in very big trouble, and it prolongs our not only economic recovery, it'll prolong the ability of our entire health system to actually be able to function. Because remember, Ari, people are still having babies, having heart attacks, have cancer diagnoses, their doctor's offices are closed, and the ERs are full. We have to find a better way to get through this.
Dr. Patel, I really appreciate your time and your sober medical counsel, which I think we can all follow. Thank you very much. We have a lot more in tonight's special coverage this hour, including how do you solve the healthcare crisis when the president keeps talking up the economic angles. Also, Congress working out
feedback, but it's going to be catastrophic if it ends up disincentivizing a lot of people, particularly in red states, from taking the precautions that they could take to make sure that their states aren't in 2 weeks where New York is right now.
Doctor?
Well, I want to see us buy some time so that we can protect the people on the front lines, like the healthcare workers. They really can't have this surge and do their jobs optimally. So if we can each take responsibility and protect our healthcare workers and support them the same way we do our military, everyone has a role to play here. And I would recommend that every person in this country make the assumption that anyone they come into contact with could have the coronavirus, and they should interact with as few people as possible, isolate as much as is reasonable, and take all of the precautions that we've been advocating so we can lower this peak and protect our frontline health workers and save lives.
Well, you know, Doctor, I don't know if you ever listened to MC Light, path-breaking female rapper. She used to say, act like you know. And it sounds like you're saying, act like you have it, act like everyone else has it, and just act like that for a few weeks until we do know. And that is one way to think about the safety. We need to take doctors and experts like yourself as seriously as possible. So that's